Okay, next coming to the concept 4, that is loading dose and the maintenance dose. So please remember the loading dose depends on the volume of distribution, whereas the maintenance dose depends on the clearance. So usually which are all the drugs which requires the loading dose? So loading dose means the high dose will be given in the form of IV bolus. What is the purpose? The purpose is to attain the steady state plasma concentration very early. So which are all the groups of drugs which requires loading dose? The loading dose is required in case of drugs with short T-half. One such example is the lignocaine that has been given IV bolus as a loading dose in the treatment of arrhythmias.